So the Strategic Leadership in Healthcare Bootcamp is an opportunity for leaders to get a very intensive, short burst of learning around an extremely important topic. This bootcamp is designed to help leaders self-reflect, think about their own role in terms of making strategic choices, and particularly in this age that we live in that's very high-tech, AI-driven, and to put some basic principles in place and to learn how to become a strategic leader. Strategic leadership for healthcare is not just for people that work in hospitals who are on the C-suite team. It's also people who are in the wider health sector who want to understand how that works. But it is for senior leaders, people who have decision-making power. It could be somebody directly who's in a strategy role or part of a strategy team, but it also could be a senior nurse. It could be a senior clinician, a medical director, somebody who's doing quality controls. Strategic decision-making happens across an organization, so you don't have to have strategy in your title to come on this program. And actually, I would encourage a breadth of people, even people who are in middle management roles, where they are either executing strategy or actually shaping a unit or a department. So what makes this program stand out is, first of all, of course, it's designed for people who are working in the health sector. So all the examples, the case studies that we'll look at are in the health sector. And that's really important because the health sector is very unique and the challenges that it faces are also very unique. The second thing that really stands out is that this program takes an approach that focuses not just on the individual leader, but more on the way that that leader forms their decision making. So there's an opportunity for participants to be quite reflective about what shapes their cognitive base, their leadership decisions. And then I think what is even more exciting is to think about how in the 21st century, with AI and dashboards and all the kind of data that comes at us as a senior leader, how do we use that and how does that affect our kind of cognitive thinking as we make choices? I think one important aspect of this boot camp is to understand what strategy is, what strategy isn't. Lots of people confuse operational efficiency with strategy. And strategy is that horizon scanning. It's thinking about where you're leading the organization. I also find that in healthcare, many leaders are so overwhelmed. They never have the chance to step back, to get what I call white space, to reflect on how they're leading and practicing. And then I'd say lastly, if you're in the NHS and you're in a system like the UK, you have what I would call a modifier, and that is the role that the state plays in our healthcare system. What we try to do in this course is work with these senior leaders to become much more proactive, to start to see the bumps and the shape of the road before they get there, and to anticipate that. And so that they're better at how they work with their staff, work with their organization, shaping it and thinking not just about how and what is coming down from up top, but how they will use that to ensure that their organization is successful. At the end of this program, they will come with their own kind of professional development plan. We will have a catch-up several months after you've left and talk through how you've been able to strive and practice what you've learned over this program. And I think that check-in is so important. It not only helps us hold ourselves accountable, but it also gives us an opportunity to see how those people that we've had this phenomenal, transformative experience with are getting on and doing and share that learning. It's an integral and exciting part of this course. So please join us at the Global Business School for Health and learn how to take your strategic leadership forward in a changing world.